Okay, welcome back to Sanjay Godawat, IIT and Medical Academy. I am Ramesh, Zoology faculty. The next topic in the body fluid and circulation, ECG. Right. ECG, okay, is the machine capture the electrical activity of heart during cardiac cycle. That is ECG. Another short name, EKG, not LKG, EKG, right? ECG or EKG, okay, that is a different name. The full form, if you take electrocardiograph, electrocardiograph is a machine capture the electrical activity of heart during cardiac cycle and represents the electrical activity of heart during cardiac cycle in computer with a graph. That is, a graph is called electrocardiogram. This is electrocardiogram. Okay, electrocardiogram. If you take electrocardiograph is a machine, right? Capture the electrical activity of heart, okay, during cardiac cycle by using the electrodes. That is a machine, electrocardiograph. Gram is nothing but the graphical representation of heart during cardiac cycle. That is a electrocardiogram. Both are different. Whereas another term like EEG also there. EEG, electroencephalogram. Okay, electroencephalography, electroencephalogram. It is EEG is nothing but like it captured the electrical activity in the brain. That is EEG. Brain, okay, activities, okay, captured and representing in computer. That is EEG, electroencephalograph, capture the electrical activity in the brain and representing in the computer. That is a graphical representation of the electrical activity of brain in computer is called electroencephalogram. Okay, gram. That is different. Okay, both are different. Okay, in this topic we are discussing only ECG, not EEG, right? So object wise ECG is there. And if you take some information about the ECG, right? ECG was invented by the scientist William Einthoven, right? The scientist name. Next point, the electrical events in the heart can be detected by using the instrument called electrocardiograph. Okay. Next, ECG is a graphical representation of the electrical activity of heart during cardiac cycle. Within 0.8 seconds, once one cardiac cycle is closed. Right, in the cardiac cycle, there are three different events like auricle systole, ventricle systole, and joint to diastole. Already we have discussed about the cardiac cycle in the previous, right? So, the cardiac cycle depending mainly the electrical excitability, that is a nodal tissue, okay, generate action potential to triggering the cardiac cycles. Okay. So, in a cardiac cycle, what is the electrical activity movements and what are the three events, okay, in the heart, okay, what is the duration, everything representing, okay, with the graphical in computer. To obtain standard ECG, right, the patient is connected to machine with three electrical leads or sensors. Okay, for standard ECG, normal ECG, like the patient, okay, connected to the ECG machine with sensors, mainly three sensors, one for each wrist and another for left ankle, right? Next, so when the electrodes are connected to the patient at different sides of the body, okay, this is heart side and this is left and right wrist sides and the below the heart side, that is the left ankle sides. Okay, ECG machine capture the electrical excitability in the heart like depolarized movement, repolarized movement, okay, is captured, okay, and representing in the computer. Okay. For detailed evaluation of the heart functions, multi-leads are used. Okay, 12 leads are used attached to the various spots of the body like chest regions. Right, this is some introduction about the ECG. Right, and before the graph about the ECG, okay, we have to discuss the nodal tissue, whereas like depolarized, repolarized in the heart, right? Right, if you take the nodal tissue structure, depolarized and the repolarized, what exactly depolarized in the heart and repolarized, right? First of all, the nodal tissue, right, this is the heart with different chambers, upper to small, thin wall chambers, auricles, the lower two thick wall chambers, ventricles, right. If you take the nodal tissue structure, this is a primary nodes, also called the pacemaker, because generate action potential without any help, right. This is the primary node. Primary node is also called the pacemaker, pacemaker or sinoatrial nodes. And the secondary node, if you take, this is secondary node, secondary node is a relay point or relay station, or AV nodes, atrioventricular nodes. It relays the action potential in the ventricles by the bundle of His branches and the Purkinje fibers. This is Purkinje fibers, right, bundle of branches, and this is bundle of His. Okay, this is secondary node. Now we go to the, okay, depolarized, repolarized. When the primary node generates, so generally when primary node generate action potential, so when the ventricles are complete passive ventricular filling, right. So due to opening of AV wall, what happened? Auricle blood slowly enters in the ventricles. So when the ventricles are completes PVF, that is 70%, when they are filled with the different blood, what happened? The primary nodes, this is the primary node, sinoatrial nodes, okay, generate electrical excitability in the hearts, that is action potential. And these first action potential, okay, first reaches to the auricle muscular agents, right. This is auricles, okay, cells. If you take, this is cell, auricle cells, multi cells, the cardiac cells, right. The cells undergoes to depolarized. Okay, what is depolarized, right? This is the cells undergoes to the depolarized. Okay, so generally before action potential in the heart, if you take the diagram, right, this is a cell, right, generally in the relaxed stage of the cell. Okay, this is first cell. If you take, there are many cells, like this. In between the cells, the gap junctions or communication channels present, okay, to forcefully conduction of action potential to the adjacent cells, right. If you take the one cell, right, in the resting stage, means in the absence of cases of action potential, okay, inside of the cell what happened? Negative charge, whereas outside positive charge. This is, okay, is the resting membrane, okay, potential. Relaxed stage, outside positive charge, inside negative, due to unequal distribution of ions, like inside negative whereas outside positive. When the action potential, okay, generated by the primary nodes, okay, slowly spread to the auricle cells. Okay, auricle cells, when receiving the action potential, what happened? Like starts. Okay, if you take the next stage, means this is the diagram is called the resting membrane potential or polarized. Polarized nothing but rest, relax. Okay, when action potential develop, the first cell, undergoes to the depolarized. Nothing but the ions move inside. Positive charge ions, right? This is cell. The channels open, sodium channels open. The results of the action potential, what happened? Sodium channels open, like some positive charge ions move inside of the cardiac cell, right? Result inside minus charge replaced as a plus, that is a depolarized, whereas outside negative. This is depolarized. Like this, what happened in the cells, auricle cells, all the cells, okay, simultaneously what happened? Like depolarized. Due to this action, connecting between the adjacent cells, like communication channels or gap junctions, the action potential spread to the muscles, auricle muscles, undergoes to the depolarized, right? That is a depolarized, means cell excited, channels open, sodium inside, okay, move inside, the reverse potential, that is a depolarized, results auricle systole begins. Auricle systole, during the auricle systole what happened? The remaining the blood passed to the ventricles, okay, remaining blood, that is active ventricular filling, active ventricular filling 30%. Okay, due to the depolarized, auricle size get reduced and the rest of the blood enter into the ventricles. Okay, during the auricle systole, during the depolarization of atria, okay, rest of the blood enter into the ventricles. That is auricle systole depolarized. Systole depolarized, both are same. Next, once depolarized complete in the auricles, the next depolarized takes place in the ventricles, right? For the ventricle depolarization, okay, for the ventricular cells depolarization, the secondary node is very, very important. Secondary nodes, right, relay the action potentials towards ventricle musculature, right? Ventricle cells, when the ventricle cells, if you take the ventricle cells, right, this is the group of ventricle cells, what happened, right, between the cells, communication channels, right, and once action potential reach, generally ventricles during the auricle systole, okay, ventricles polarized, resting, right, and once action potential arises to the ventricles, start depolarized, means the influx of sodium ions, results systole. During the ventricle systole, what happened? Okay, auricle slowly repolarized. Repolarized is nothing but, right? In the repolarized, what happened? If you take the continued diagram of the repolarized, right, and in the repolarized, potassium channels open. Potassium channels open, right, and start efflux. Okay, so results what happened outside plus, whereas inside negative. This is repolarized. In the repolarized, what happened? During the ventricle depolarized, auricle cells undergoes to repolarized. In the repolarized, efflux of potassium ions. Okay, that is the repolarized. Okay, and after, okay, ventricle systole. During the ventricle systole, what happened? The ventricle blood pumped to the different parts. Right, the right ventricles deoxygenated blood towards lungs, whereas okay, left ventricle oxygenated blood move towards systemic capillaries for the exchange gases, nutrients, right. This is ventricle depolarized. During the ventricle depolarized, what happened? The auricle cells undergoes to repolarized, okay, and after completion of the systole, then relax, okay, all the chambers get relaxed, that is a final event, okay, auricle systole, the ventricle systole, then cardiac diastole. This is the events of the hearts, right. First auricle systole depolarized in the atria, next ventricle systole, okay, ventricle depolarization, right? Ventricle depolarization. During the ventricle depolarization, auricle slowly repolarized. Then the chambers, all the chambers come back to the resting. That is a cardiac diastole. In the cardiac diastole, what happened? All the cells, okay, undergoes to repolarize, then slowly resting again. Okay, in the repolarized, after repolarized, resting, right? In the resting, what happened? Before to reach resting, ions come back, right? In the depolarized sodium influx, right? Whereas in the repolarized potassium efflux, whereas to get resting, ions come back, okay? Which means the sodium efflux, whereas the potassium influx. This is ions back movements, okay. Results what happened? Inside negative charge, whereas outside positive charge. This is polarized, resting membrane potential or polarized, okay. For depolarized and repolarized in the cardiac cells, they need, nodal tissue. Without nodal tissue, there is no depolarized and the repolarized. That is importance of the nodal tissue. This is nodal tissue, right? The nodal tissue triggering, okay, like action potential for the maintaining of the, okay, electrical, for maintaining of the cardiac activities in the hearts. That is importance of the nodal tissue. For example, nodal tissue if does not generate like action potential, there is no depolarized, repolarized in the hearts. Without depolarized, repolarized, there is no, okay, pumping blood from the hearts. That is the importance of the nodal tissue and the depolarized, repolarized, right. If you take the graphical representation about the cardiac activities, right, this is relaxed stage, right. The graph slowly shift upsides. This is depolarized, right. Then depolarized ventricle. If you take the graphical, this is ECG. It representing about the electrical excitability in the hearts, right. It includes some waves, right. So, if you take the P wave, this is the P and this is the Q, this is R and this is S and this is T. This is graphic representation of the heart during cardiac cycle with the different waves, right. In that the P wave, right, this is the P wave representing auricle systole, right, auricle depolarization, auricle depolarization. So, when the action potential move towards like auricle cells, the cells undergoes to depolarize. This is, okay, the P wave representing, auricle depolarization or auricle systole. Next, okay, this is the QRS. The QRS is a complex wave. This is the QRS complex. QRS complex representing like a ventricle. QRS complex wave representing ventricle depolarization or ventricle systole. This is ventricle depolarization, QRS complex. Next to the T wave representing, okay, T wave representing repolarization of the ventricles, repolarization of ventricle, right. This is the graph of the ECG, okay, with the waves, different waves. The P wave always representing, right. So, this is neutral position, this is plus, this is minus. If you take, means the in ECG machine what happened, the instrument, okay, like arrow line, okay, during the depolarized what happened, okay, arrow move towards plus sides, positive sides, whereas in the, okay, neutral position becomes stable, whereas, okay, some cases the arrow moves to downsides, okay. This is the movements of the arrow in the instruments, okay, in the ECG graph, right? And during the electrical excitability, okay, what happened? Based on this electrical excitability, the arrow of the machine, okay, becomes move up and downs, right? Depolarization move up, repolarized down, right? This is like a graphical representation of the ECG, right? This is objective-wise very important. What is the P wave representing? In the ECG, P wave representing auricle depolarized or auricle systole. QRS is a complex, right? The Q is small negative, R is positive, S is a negative, right? The QR is complex depolarized, ventricle depolarized, and T wave is the final wave representing like a ventricle repolarization, right? And this is the ECG. In that depolarized, repolarized, okay, very important. Now come back to the ECG main slides, right? This is the graph. Different waves include, right? P, QRS and the T. The P representing auricle depolarized, QRS complex representing the ventricle depolarized, whereas the T wave is representing like a ventricle repolarization. Next we go to the waves, the information, different waves like P, Q, R, S and T. With P wave like electrical excitability of atria to contraction both, okay, atria or depolarized. QRS depolarization of the ventricle. The T wave represents repolarization of the ventricles. The end of the T waves is which indicates end of the systole, right? And this is the nodal tissue diagram, whereas if you take the electrical movements, okay, this is the electrical, okay, movement in the heart. First node generate action potential, then pass towards auricle, then secondary node relay towards ventricle musculature by bundle of its branches, the Purkinje fibers. Once again, okay, next to evaluation of the ECG patterns, right? Before the evaluation, this is the ECG, okay, graph, include different waves, right? P wave, the Q, R, S and the T, right? Different waves, P wave, Q, R is complex and the T, whereas including waves in the graph, intervals also present, right? If you take the intervals, P R interval, this is the P R interval, PR interval or PQ interval from the beginning of P and from the beginning of the QRS complex. The PR interval representing like a duration from beginning of P to the beginning of the QRS complex, that is a PR or PQ interval. Next to QT from the beginning of the QRS complex, end of the T, right? This is QT, QT interval, right? The QT interval representing the duration from the beginning of QRS complex to the end of the T. And RR interval, RR interval if you take from the beginning of the P, okay, end of the T, right? This is RR interval, right? The RR interval representing the complete cardiac cycle duration, right? From the beginning of P to the beginning of the the ending of the T, right? This is RR. RR interval representing the complete cardiac cycle duration from the beginning of the P to the end of the T, right? This is some intervals. Now the evaluation of the ECG. Evaluation ECG, first of all, the enlarged P, right? This is enlarged P, enlarged become when the P become enlarged in the graph. What happened? This is normal P, right? When the P become enlarged like this, enlargement of the atria which indicates. So based on the ECG waves and the intervals duration, okay, the doctor detects abnormalities in the hearts, right? That is important. Whereas variations in the QRS, this is QRS, variations in the QRS, right? Variations in the QRS, what happened? Okay, bundle of branch block which indicates, right, bundle of branch problem, okay, delay conduction in the ventricles. Enlarged T, right, the T, okay, this is T, right, enlarged T, what happened? Like hyperkalemia, which means the potassium levels increases in the bloods, okay. Next, small t, right, small t, right, small t, what happened? Like hypokalemia means the potassium levels decreases, which indicates. Next to prolonged PR or PQ, prolong, what happened, right? Bradycardia means, okay, low BP, low blood pressure, right? The shortened PR interval, tachycardia, okay, hypertension, high blood pressure, hypertension. Okay, the prolonged QT interval, right? The QT, this is QT, prolonged QT interval, myocardial damage, okay, the damaged cells, myocardial ischemia, lack of blood supply to the hearts, okay, myocardial infarction, okay, or heart attack. Myocardial infarction, nothing but heart attack, okay, die of some cardiac cells, myocardial infarction or heart attack. And hypothyroidism, abnormal secretion, thyroid hormones. Hypothyroidism, nothing but hyposecretion. Thyroidism is two, hypo and hyper. Hyposecretion thyroid hormone, that is hypothyroidism. Hyposecretion thyroid hormone called hyperthyroidism, right? Hypothyroidism also. The next to the shortened QT interval, right? QT interval shorts, hypocalcemia means the calcium levels excess in the bloods. So this is some evaluation of the ECG patterns. Now finally, okay, ECG waves, intervals, okay, is close. Whereas if you take the prolonged RR interval, okay, the cardiac cycle, okay, duration is expands more than 0.8 seconds. Whereas the shortened RR interval, what happened? Okay, cardiac duration is below than 0.8 seconds. Right. This is some evaluation of the ECG patterns. Okay, and this is ECG introduction, right, and waves, right, the wave movements in the heart, okay, like depolarized action potential movement, okay, evaluation, right, and next to depolarized, right, depolarized, okay, events in the heart, action potential, okay, developed by the primary node, the first auricle cells depolarized, right, depolarized, what happened? Sodium influx. Next, what happened? During the auricle depolarized, ventricles like a resting stage. Then what happened next to action potential move towards ventricle side, causes depolarized. Okay, after depolarized, repolarized. In the repolarized, potassium afflex. In the depolarized, sodium inflex. Positive charge inside, depolarized. Okay, whereas positive outside, okay, that is repolarized. Then finally polarized. When the action potential disappear, all the cells undergoes to, okay, like polarized by the sodium potassium pumping. Polarized means in the pumping what happened, sodium afflex, potassium inflex, okay, polarized, and it is ready to for the next impulse, right. Once impulse generate, again what happened, like a next depolarized and repolarized events or takes place in the heart, right. This is the ECG. Finally, okay, ECG, okay, is closed, right. Thank you.